What are your thoughts on routine testing for VDR polymorphisms, e.g. TAC1, FOK1, to guide treatment for patients with persistent inflammatory or autoimmune symptoms?
Well, I'd like to reemphasize I'm a PhD, and so I'm just going to reiterate what I'm learning from Dr. Zilsdorf, who's an MD, and also with a master's in science and microbiology. And so what I've learned from her is that when she has complex patients, she always tests them for these vitamin D receptor polymorphisms. And I think that you'll find maybe a couple of % of the population have these polymorphisms. And that's just this one receptor. And we're hearing that there are polymorphisms in other elements of the vitamin D biosynthesis pathways. Okay, I know the frequency of those mutations, but chronically ill patients seem to have polymorphisms in various pathways. The tests for these vitamin D receptor polymorphisms, as I understand, are straightforward to access. So I'm just channeling Sarah Zilsdorf with this. Yes, get them tested. And managing them, just my readings of the literature and talking with Dr. Zilsdorf, is you can treat with higher levels of vitamin D3, but as what I've been saying here is that you may shift to calcifediol, which is available on Amazon. I'm not allowed to say what this product is, but that's where I get it, and I use it. And it's a product from Spain. So at least in the US and Australia, calcifediol is commercially available. The use of calcitriol, it's available by prescription, but again, suggest that you look into paracalcitol, which is much less calcemic than calcitriol. And so these are what I read about treating people with VDR polymorphisms, increased vitamin D3, or direct vitamin D receptor agonist, calcifediol, calcitriol, and paracalcitol. Just we're on this subject, mast cells, since we watched this film, focused on that. These are two papers that I read in preparation for the meeting. And one is from 2017, vitamin D contribution to mast cell stabilization. So viewing vitamin D receptor agonists as mast cell stabilizers. Now, this is a review from 2024, role of vitamin D in mast cell activation syndrome. Okay, so the synthesis of how this pathway and the activation of vitamin D receptors, how it can tamp down mast cell activation, this hypersensitivity, I think that's one part of this jigsaw puzzle to treat it. And Sarah's protocols, which she put in LDN Book 3, is get your autoimmune patient, and I would also suspect she would encourage people to do the same for MCAS patients, get that calcifediol level from 20, 30 nanograms per mil up above 50. And in the case, I know for autoimmune patients, she moves it to 60 to 80 nanograms per mil. And by taking calcifediol, it's absorbed about 3 times more effectively than vitamin D3. And I learned today from a participant at this meeting, you want to take it with vitamin K2 to help promote the absorption of these vitamin D metabolites. So, yeah, again, I'm speaking as a PhD researcher. I research PubMed at this point, and I research what the doctors are saying and try to put those pieces together. So that's where my answer to the question is coming from.